Welcome back. This is the second video in our vital signs lecture. The first video reviewed the basics of vital signs as well as how to obtain body temperature. In this second video, we are going to discuss how to obtain a blood pressure, pulse, and respiratory rate. Let's get started. The first one that I would like to go over is how to obtain a pulse. And each time your heart beats, it's going to pump blood through the arteries and vessels that carry blood away from your heart and throughout your body. So the heartbeat is going to create waves of blood which you can feel pass through the arteries if you put your fingers over certain places on the body where the artery lies close to the surface of the skin. Between beats, the heart is going to rest. Then it beats again, causing another wave that you can feel. The wave that you can feel is called the pulse. When you count the number of times you feel a person's pulse beat in 1 minute, then you know how fast the heart is beating. The number is called the heart rate or pulse. So the pulse is simply the number of times the heart beats in 1 minute. So there are many different areas on the body in which you can obtain the pulse. However, the one most commonly used and the one that you will be asked to use when you take your skills exam is going to be the radial artery. The radial artery is always found on the thumb side of the wrist. So the radial pulse is evaluated by placing your fingers on the inside of the wrist on the thumb side and counting the number of pulsations that you feel in 30 seconds. Then, because heart rate or pulse rate is always reported in beats per minute, you would then multiply the number that you obtained in 30 seconds by 2. If the pulse is irregular, however, then you must count for 1 full minute. Then, of course, we would not multiply the final number that we obtained by 2 because it's already being reported in beats per minute. So here's an example of what I mean. Once again, if a pulse is regular, you simply count for 30 seconds and multiply by 2. If it is irregular, then you must count for 1 full minute, and then you would not multiply by 2. So heart rate or pulse rate is always reported in beats per minute. Regular rate means there's an equal amount of time between pulsations. Irregular rate means that there is not an equal amount of time between pulsations. So here's an example. Mr. Smith has a regular pulse rate, so you count for 30 seconds. In those 30 seconds, you count 45 pulses. What would you document as his pulse rate? So of course we would just multiply 45 by 2, which would be 90. So his heart rate or pulse rate would be 90 beats per minute. Let's try another one. Mr. Smith has an irregular pulse rate, so you count it for 60 seconds. In those 60 seconds, you count 80 pulses. What do you document as his pulse rate? So of course, because we counted for 1 full minute, there's no need to multiply by 2, so we would simply report 80 beats per minute. Okay, so as a review, normal range is 60 to 100 beats per minute, and you may see some discrepancies between various textbooks or various videos, and that's okay. The normal range that we go off of is the one that UNAR uses, and that's going to be 60 to 100 beats per minute. So anything less than 60, you would report to the nurse. Anything higher than 100, you would report to the nurse. Okay, so quick review of some vocabulary terms. Tachycardia means that the heart rate is too high. Bradycardia means that the heart rate is too slow. In medical terminology, tachy will always mean too fast and brady will always mean too slow. You'll see that on different medical terms. Another common pulse site is the apical site. You are listening directly over the heart with an apical pulse. You will place your stethoscope directly over the apex of the heart, which is just simply the bottom part of the heart. And of course, your heart is located on the left side of your chest, just about 2 to 3 inches left of your sternum. And whenever we take an apical pulse, we always count for 1 full minute. So an apical pulse is generally not felt. It's generally only auscultated, which means you're listening to it with your stethoscope. Now, in very thin individuals or in babies, you can actually visibly see their apical pulse, but with most individuals, the abdominal fat is covering the apical pulse and you're unable to see it. You'll just be able to hear it. Another common pulse site is the carotid pulse, but we only use it with CPR because in some patients with heart disease, putting pressure on a major blood vessel like the carotid artery can be dangerous. But it is a good one to check in emergency situations because it's quickly accessible. Let's move on to respirations. Respirations are like pulse in that we are counting for 30 seconds and multiplying by 2 unless they're irregular, in which case we count for a full minute and then of course we would not multiply by 2. So when we count respirations, we are counting the process of inhalation and exhalation. So one respiration equals one breath in and one breath out. It's important to count respirations while the resident is unaware of what the procedure is that we're doing, because patients can then start controlling their respirations. It's impossible not to alter your respiratory rate when you are conscious of your own breathing. The respiratory rhythm is the regularity with which the person breathes. In normal breathing, the breaths are evenly spaced, and again, that means that the respirations are regular. If the breathing is irregular, again, count for one full minute. So normal respiratory rate is 10 to 20 beats per minute. And that is the range that will show up on the Utah State CNA exam. So this is absolutely critical that you memorize this range. So here we see those prefixes come up again. A vocabulary review. Tachypnea is going to mean that the respiratory rate is too high, and bradypnea is going to mean that the respiratory rate is too slow, because of course tachy always indicates something is too fast and brady always indicates something is too slow. Dyspnea is another important vocabulary word to know, and the prefix dys always means difficulty of. So dyspnea is difficulty breathing, and apnea is the complete absence of breathing. So the prefix a always means without or absent of. Once again, a complete respiratory cycle is one inhalation and one exhalation. So when someone breathes in and then they breathe out, we count that as one breath when we are counting respirations. Okay, let's talk about blood pressure. Blood pressure measures the pressure of the circulating blood on the walls of the arteries. Each time the heart beats, it's going to pump blood into the arteries. The pressure of the blood against the walls of the arteries when the heart pumps is called the systolic pressure, and the pressure of the blood against the walls of the heart when the heart relaxes, or excuse me, the walls of the arteries when the heart relaxes, is called the diastolic pressure. So the equipment that you'll need to use to measure blood pressure is going to be a stethoscope and of course a blood pressure cuff. So when we are obtaining a blood pressure, we always use the diaphragm of the stethoscope. And the diaphragm is the larger part of the stethoscope. The bell is the smaller part of the stethoscope that we use to obtain, to listen to certain heart sounds, which you won't be asked to perform. So you just want to focus on the diaphragm of the stethoscope, which is this lower part here. And something important to note for the skills test is that you will want to clean the earpieces and also the diaphragm of the stethoscope with an alcohol wipe between each patient. So you will wrap the blood pressure cuff around the arm that you will be obtaining the blood pressure on, and you usually wrap the cuff about 2 to 3 inches above the antecubital space, and the antecubital space is just your elbow crease. So you will then place the diaphragm of the stethoscope over the brachial artery, and the brachial artery is found about 2 to 3 inches above the antecubital space or the elbow crease, and it's always found on the inner aspect of your arm or on the pinky side of your arm. So after we wrap the blood pressure cuff around the patient's arm, we'll then place the stethoscope directly over where we felt that brachial artery. And if you look at your blood pressure cuff, you'll notice that there is a little arrow where it'll say left arm or right arm, and you actually want that arrow pointing right above to where you felt the brachial artery. An important piece of equipment to know is that the dial that is found on the stethoscope is called a sphygmomanometer. Sphygmomanometer. So the state skills test keeps things fairly simple for you because instead of using a more accurate way of obtaining a blood pressure, which is the pulse obliteration method that we'll cover in a different lesson, you're simply asked to pump the blood pressure cuff up to 180 millimeters of mercury on all of your patients, regardless of gender or of any other factor, really. You'll just simply pump up to 180. So if you look at this sphygmomanometer, you'll see that it is calibrated by the little lines, each representative of 2 millimeters of mercury. And that means that you will never obtain an odd number on a manual blood pressure. It would be impossible to obtain anything other than an even number because each of those little lines that you see on this sphygmomanometer are indicative of 2. So you can see that it starts with 20, and then if you went to that next small line, that would be 22, and then this larger line would be 30. As you let the air slowly out of your blood pressure cuff by turning the dial to the left, you are going to want to notice the very first sound that you hear, as well as the very last sound that you hear. And these two numbers are going to create your blood pressure. So once again, the systolic number is going to be the number that is written on top, and that is going to be the very first sound that you hear. The diastolic number is going to be the number at the bottom, and that is going to be the very last sound that you hear. Normal blood pressure ranges according to the Utah Nursing Assistant Registry. For systolic is 90 to 135, and for diastolic, we use 60 to 85. So these are the ranges that will show up on both the state written and skills test, regardless of what you may see documented as normal findings in other resources or even in your individual facilities. So a quick vocabulary word review. Hypertension is that the blood pressure is too high, and hypotension is when the blood pressure is too low. So the prefix hyper always means too much or excessive. You can remember that by thinking of a hyperactive child. And the prefix hypo always means below, and I think of this by remembering that a hippo is under the water, and by picturing that, it helps me remember those prefixes. Okay, that's it. Just a real brief introduction to blood pressure, pulse, and respirations. In subsequent videos, we will go over how to specifically perform each of those skills.